We're talking with Leanne Minot, good friend of mine. Leanne, thank you for coming to the Dr. Bob Show.
Thank you for having me.
In April of 2013, you were going to run a race. What happened?
Well, I was in Charleston on spring break with my family, was going to run the Cooper River Bridge Run 10K, 6 miles, for the 5th year in a row. But I'd been having shortness of breath for a month, maybe 2 months before that, and I'm a regular runner.
So you'd been running for a long time?
Every day for 7.5 years.
And how much would you run?
3 to 5 miles, usually 3 to 5 miles.
So you knew your body and you knew running, and you were getting short of breath, so you knew something was going on?
I knew something was wrong because I couldn't even run the first 100 yards. And I was signed up to run this 10K, and I couldn't do that. So I was wondering what was wrong.
So what did you do?
Went to a walk-in clinic affiliated with a hospital in Charleston, and the physician, did a physical exam followed by a chest x-ray and discovered fluid built up around my right lung.
Fluid in your lung, and that was the beginning of finding out that you ended up having what disease?
Well, stage 4 ovarian cancer.
Stage 4 ovarian cancer, meaning that it had spread.
Correct.
And so you ended up seeing Dr. Larry Kilgore, and in looking back at the symptoms that you had, was there anything that made you think of, in retrospect, that you could have had this ovarian cancer for a long time?
I probably had ovarian cancer for a year before it was diagnosed. And ovarian presents with fluid buildup in women. Sometimes it will build up in the pelvic area, sometimes in the abdomen, feeling of fullness.
Did you have any of those symptoms?
I did not. Mine presented the fluid built up in the lung area, which made it stage 4.
Now, 3 or 4 months before this happened, before April 2013, you had a hysterectomy. Was that because of what problem?
What I thought was just routine fibroid cysts that had grown in the uterus.
So you were having some problems there, and they did a hysterectomy, and then 3 months later they found fluid in the lung.
Correct.
How hard was your treatment?
Very difficult.
Very, very difficult.
Very difficult.
You mentioned to me that you felt like, and your doctor felt, Dr. Kilgore felt, you handled the treatment very good because of what?
Well, in part, God helped me get through it, in part Dr. Kilgore, but in part because I was healthy to begin with, and I went into the cancer diagnosis with strong heart, strong lungs, and able to tolerate very aggressive treatment.
In your follow-up of treatment, you mentioned that there was one thing that you need to keep on doing to keep this cancer from recurring, and that would be what?
Well, I went to MD Anderson in Houston just to make sure there wasn't something out there I was missing, and I peppered the ovarian specialist with every question I could think of what can I do for this not to come back. Ovarian has a high recurrence rate. And he kept telling me there was really nothing I could do until I got to the question about exercise. And he said, absolutely, ovarian cancer recurrence can be reduced by 25% with regular exercise.
Have you been exercising regularly?
Almost every day.
Leanne, you look great. Are you back to work?
I am full-time.
Full-time attorney, and you're working a 8-hour or 12-hour day?
8 hours at least, yes.
You look wonderful, and
Thank you.
we thank you for coming to the Dr. Bob Show and telling us your story.
Thank you for having me, Dr. Bob.